Hello and welcome. Today, we'll be discussing anal abscesses, a painful condition affecting the area around the anus and rectum. We'll cover what they are, what causes them, how they're diagnosed and treated, and what you can do to prevent them. So, what exactly causes an anal abscess? Most commonly, they arise from an infection of the anal glands. These small glands located inside the anus produce lubricating mucus. If one of these glands becomes blocked, bacteria can get trapped inside, leading to infection and the formation of an abscess. Less frequent causes include inflammatory bowel diseases like Crohn's disease and ulcerative colitis, anal fissures, sexually transmitted infections, and trauma to the anal region. In some cases, no specific cause can be identified. Let's delve into the pathophysiology. When an anal gland becomes blocked, bacteria, typically from the normal gut flora, multiply within the gland. This bacterial overgrowth leads to inflammation and the formation of pus. The pus, a collection of dead white blood cells, bacteria, and tissue debris, becomes trapped, forming an abscess. The abscess continues to expand, causing pressure and pain in the surrounding tissues. Eventually, the abscess may rupture spontaneously, draining pus, or it may remain contained, requiring medical intervention. While precise epidemiological data varies, anal abscesses are relatively common. They affect men more frequently than women, with a peak incidence between the ages of 30 and 50. Individuals with certain medical conditions, such as diabetes, inflammatory bowel disease, and compromised immune systems, are at higher risk of developing anal abscesses. The signs and symptoms of an anal abscess can be quite noticeable and uncomfortable. The most common symptom is persistent, throbbing pain near the anus. This pain often worsens with sitting, bowel movements, or coughing. You might also notice swelling, redness, and tenderness in the area. Other symptoms can include fevers, fatigue, and drainage of pus from the area around the anus. In some cases, it may be difficult to sit or walk comfortably. Diagnosing an anal abscess typically involves a physical examination by a doctor. They will visually inspect the area around the anus for signs of redness, swelling, and tenderness. A digital rectal exam, where the doctor inserts a gloved, lubricated finger into the rectum, may be performed to assess for internal abscesses. In some cases, imaging studies like an MRI or CT scan might be necessary to evaluate the extent of the abscess, especially if it is deep or complex. Anal abscesses are often classified based on their location. Perianal abscesses are the most common type, located near the anus. Ischiorectal abscesses are deeper, located in the space between the rectum and the hip bone. Intersphincteric abscesses are located between the internal and external anal sphincter muscles. Supralevator abscesses are located above the levator ani muscle, which supports the pelvic floor. The primary treatment for an anal abscess is surgical drainage. This involves making an incision in the skin near the abscess and draining the pus. The procedure is typically performed under local or general anesthesia, depending on the size and location of the abscess. Following drainage, antibiotics are often prescribed to help prevent further infection. Pain management is also crucial, and over-the-counter or prescription pain relievers may be recommended. Sitz baths, where you sit in warm water, can also help relieve discomfort and promote healing. Unfortunately, preventing anal abscesses entirely isn't always possible. However, there are steps you can take to reduce your risk. Maintaining good hygiene by gently cleaning the anal area after each bowel movement is essential. Avoid straining during bowel movements to prevent anal fissures. If you have inflammatory bowel disease, managing your condition effectively can also help. A high-fiber diet and adequate fluid intake can promote regular bowel movements and prevent constipation. The prognosis for anal abscesses is generally good with prompt and appropriate treatment. However, a complication that can arise is the development of an anal fistula. An anal fistula is a small tunnel that connects the infected anal gland to the skin surface. If a fistula develops, additional surgery may be necessary to correct it. Recent research is focused on developing less invasive techniques for draining abscesses and treating fistulas. Additionally, studies are investigating the role of antibiotics and other medications in preventing abscess recurrence. Ongoing research continues to improve our understanding and treatment of this condition.